Hey, I wanted to ask you about hospitals because I this is an issue that's very important to me personally, and I'm looking at certain governors. I don't think your governor did this, and the attorney general, a number of health officials in Washington D.C. said, not in a way that was a mandate, but when the attorney general says something to hospitals, they have to listen.
Right.
They said that you should clear the decks to all the hospitals, cancel all of the elective surgeries, so that hospitals could be better prepared for an onslaught of COVID patients. And there was this specific case where New York and Manhattan, the hospitals, many of the hospitals at least, are getting crushed
Right.
with COVID patients. But in Syracuse, across the state, because of this de facto mandate that there shouldn't be elective surgeries, all these beds are sitting empty. And as a result, you have a complete drain of resources that would be used by hospitals to keep those services ready for when the onslaught happens, if it does happen. What's going on in Tennessee with that?
Well, actually, Governor Lee did issue an executive order which prohibited hospitals from and medical providers from doing elective surgeries. And they also did something similar, I think, with dentists. And yeah, the impact has been that the non-emergency hospitals, like the orthopedic clinics, as well as the rural hospitals, have really suffered because that was one of their main revenue sources. So there's a clinic in town here. It's a big orthopedic clinic, and they furloughed all of their nurses, all of their physicians assistants. The doctors are taking significantly reduced salaries, and they're just trying to make it through. So that has happened here. I think it's something that people need to keep in mind is when we're talking about the models and all that sort of stuff and the transmission of COVID-19, there's a significant difference between New York City, which has a population density of over 25,000 people per square mile, and say Knox County, which is still an urban county here in Tennessee, but we have population density of a little over 900 people, 1/26th of what New York City has. I'm thankful that President Trump has not just said, this is what we're going to do nationwide, because it really does vary quite a bit depending on where you live. As you say, in Syracuse, I can imagine they're probably much less hard hit than they're going to be in New York City. So that's one of those things where I think local decisions, even if it is something like that, that's a mandate, I think local decisions are much better made than decisions that come from the top down.
It seems like there's a lot of very difficult choices that doctors and patients are going to have to make anyway, because another one of perhaps unintended consequences, I believe it was the governor of Georgia, mandated that cancer patients, that their treatments would be deemed elective. And again, this seems like a sweeping overstatement that ignores the fact that every single patient and every single doctor and every single facility is dealing with a unique situation every time they have to make a decision. And cancer patients, of course, are very exposed. Their immune systems are weakened, and there is that trade-off. But I'm asking how anyone in a state capital could possibly know better than doctors and patients how to make that decision.
Right. The thing is that the market does work, and when it's allowed to.